AAPC CPB Bundle Exams Questions and Answers 2025/2026 Verified Bundle. JR had surgery on January 15th, 20XX by Dr. Waters, a Medicare participating provider. The Medicare fee schedule for the surgery is $500. 4 months later, JR and Dr. Waters each received a check from Medicare in the amount of $400. JR signed over his $400 to Dr. Waters. JR had previously paid the doctor $100 for THE coinsurance. In total, Dr. Waters has received $900 for the surgery provided on January 15th, an overpayment of $400. What should Dr. Waters do? Answer: contact the MAC of the overpayment and provide a refund. Which one is not a non-physician practitioner, aka mid-level provider? Answer: resident. Which federal law requires written acknowledgement of consumer billing disputes and investigation of billing errors by creditors? Answer: Fair Credit Billing Act. Mr. Doyle had seen a non-participating provider for a hernia repair in outpatient surgery. His insurance company, Telehealth, provided a reimbursement check of $400 for the anesthesia services provided to him for the surgery. Mr. Doyle cashed the check and kept the money. Mr. Doyle receives the bill from the anesthesiologist, but he no longer has the money to pay it. The account becomes delinquent and is outsourced to a collection agency. The collection agency is unable to obtain any monies from Mr. Doyle. What is considered? Answer: bad debt. Relative value units, RVUs, are payment components consisting of: answer, physician work, practice expense, professional liability/malpractice insurance. Which of the following falls under the Prompt Payment Act? Answer: clean claims. Must be paid or denied within 30 days from the date of receipt by max. 25-year-old is 32 weeks pregnant. She was admitted to the labor and delivery unit because she was having severe pre-eclampsia and needed to have an emergency cesarean section. Reduced payment was sent to the obstetrician by the payer with a remittance advice stating that pre-authorization for the cesarean section was not obtained. What does the biller do? Answer: appeal the claim, explaining the reason for the emergency cesarean section. When a provider chooses not to participate in the Medicare program and does not accept assignment on claims, the maximum amount the provider can charge is % of the approved fee schedule amount for non-participating providers. Answer: -115. Mr. Allen is scheduled for an appointment with his physician for follow-up of his rheumatoid arthritis and hypertension. The physician is called away for a personal 1/2 emergency just after Mr. Allen arrives for his appointment, and the patient is seen by the physician assistant, who orders labs and refills the patient's prescriptions. Mr. Allen is scheduled to return in 1 month. How should this patient's visit should be billed? Answer: under the PA as the incident to guidelines have no been met. Jill presents to Dr. Calvert for collagen injections to her upper lip for cosmetic reasons. She is informed by the office staff that cosmetic surgery may not be a benefit of her insurance plan, in which case she would be responsible for the child ridges. Jill requests the claim to be submitted to her insurance. The claim is submitted to her insurance for payment. Dr. Calvert's office receives a remittance advice stating that the injections are considered cosmetic and are not a covered service. What is the appropriate next step for resolution? Answer: move charges to patient responsibility and send the patient a statement. The financial policy for Midtown Physicians Group states that when all means for collecting payments have been exhausted and payment has not been received within 120 days, the account is turned over to a collection agency. When generating an accounts receivable aging report, you see an outstanding claim from Mrs. Smith that has not received payment for 150 days. Mrs. Smith's account is considered to be: answer, delinquent. Which of the following is considered by CMS to be a source document when a provider And billing service file claims electronically. I. Patient's registration form. 2. Routing slip. 3. Superbill. 4. Encounter form. V. Charge slip. 6. Patient's insurance card. Answer 2V. A hospital charge master does not include underscore 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 underscore. Answer diagnosis codes. ICD-10-CM. Mary is tasked to perform an audit on DR. Payne's practice to verify charges are documented as reported. What are the key elements Mary needs for the audit process? On 25 records to support what DR Payne is charging? Answer medical record. Encounter form. CMS -1,500 claim form. Mr. Peabody is an established patient who was told by Dr. Woods to come back for an injection in his right knee if he was still getting pain due to arthritis. Mr. Peabody isn't for just the injection. The physician only examines the KNEE problem-focused exam before he gives the injection. Dr. Woods explains the risks associated with the procedure and the patient gives consent. The doctor prepped the knee with betadine and injects the right knee with 10 milligrams of depomedrol. How is this VICIT reported? Answer -20,610. G1020. Powered by TCPDF. www.tcpdf.org. 2/2.